So thank you for having me at the BAU conference meeting. I had two talks at this meeting. The second presentation was on the evidence for open radical cystectomy compared to robotic cystectomy. And this is quite interesting because the literature is not very convincing, if you like, for the differences between the two. And we actually see that in robotic prostatectomy, that there was no really good randomized control trials, and the ones that have been done probably are impacted either by recruitment, because people want the preferential treatment, or because of incorporating learning curves. So if you bring a new technology, the likelihood is that if you're comparing with open surgeons, they're going to be a lot more experienced than younger surgeons taking up a new technique. So we looked at the evidence. There is evidence from the meta-analysis. We know that things like blood loss is lower, transfusion rates are lower, and this is directly related to pneumoperitoneum and the pressure that you get on the venous bleeding. We think that there's likelihood that minimally invasive approaches are better for early recovery. And interestingly now, because there has been this argument with governmental bodies that there isn't the evidence, it actually gives you an opportunity to recruit to new studies. So there's a couple of studies that are nearing completion or have completed, such as the RACE study being led by the Netherlands, and the IROC study, which is a comparison between open and robotic cystectomy, but a completely intracorporeal robotic cystectomy approach. So that'll be a very interesting study. That's being done by Sheffield. James Caddo is the lead investigator for that, and John Kelly from University College London is one of the main surgeons in that, and that's going to look at not just recovery and survival rates, but also time back to normal activities, which would be very interesting, and they're able to do that with these home sensors. So I think keep your eye out for those studies. They'll be available in the next 6 to 12 months, and hopefully they will answer this important question of whether or not robotic surgery is actually beneficial for patient outcomes.